Our last speakers are from Bristol Elder Services, an agency designated by the Commonwealth as the central point for community-based long-term services and supports for older adults who live in the greater Attleboro, Fall River, and Taunton areas. Amanda Aguiar is a home care case manager who coordinates these services and advocates for her elder consumers. Amanda works with community partners to assist consumers to maximize benefits and resources. Kristoffer DaCosta began his career at Bristol Elder Services as a Meals on Wheels delivery driver when he was a college student. After gaining some experience in the field, Kristoffer's passion for helping others led him back to Bristol Elder Services, where he now serves as Geriatric Support Services Coordinator on the Senior Care Options team. Kristoffer?
Good morning, everyone, and thank you for taking the time today to attend our annual Caring Force Rally. Just 2 years ago, I was attending my first rally in the State House. Actually, today, I found out this morning it was the exact date. I am so grateful we are able to hold the rally this year. House Bill 266 and Senate Bill 120, an act establishing a loan repayment program for direct care human service workers, could change the lives of workers in our field. Most of my friends and coworkers in our field are burdened with student loan debt that inhibits us from being more financially secure. Bristol Elder Services and many other providers require at a minimum a bachelor's degree for all positions. As a teen, going to college was not only my dream, but it was also my father's dream as well. He was born in Portugal and moved here with his parents and 7 siblings in the mid-1960s. College wasn't an option for him. He worked in a factory like many immigrants for most of his life. I was the first in our family to attend college and receive a bachelor's degree. When I graduated from Bridgewater State University, my debt accumulated to around $82,000. My father pushed me to go to school so I could have a better career than he did. His vision was not for me to pay around $500 monthly towards my education for the next 12 or more years. I knew after graduating, I wanted a career helping others, and I'm so grateful to have the opportunity to do so daily. A student loan repayment program for human service workers would help me continue doing what I love. If passed, human service workers making less than $50,000 per year would be eligible for up to $150 a month to help pay back qualified student loans. The program would help my colleagues and I remain in the community-based human service sector and ensure that the consumers we work with would continue to receive high-quality, consistent care. At Bristol Elder Services, we work with elderly clients who look at us like a part of their family. Each time we lose a staff person to another field or state position, we risk taking away an essential part of our elders' day-to-day lives. Given an option of a loan repayment program would assist our essential workers to continue providing the best care possible. Please go out there today and speak to your state legislators, emphasizing the need for such an important program. Ask your legislators to create a student loan repayment program for human service workers so we can keep working in this field and provide critical care to 1 in 10 Massachusetts residents, our family, friends, and neighbors. Thank you.
And now Amanda.
Hi, good morning, everyone. I'd like to thank you all for being here today. As Lydia said, my name is Amanda. I'm a home care case manager with Bristol Elder Services. I'd like to briefly talk to you all today about Senate Bill 105 and House Bill 237, an act relative to fair pay for comparable work. State and federal agencies such as the Office of Supplemental Security Income, the Department of Developmental Services, and the Department of Mental Health pay substantially higher salaries than a home care case manager. And those positions also come with state and federal benefits. The salary for a new aging service access point case manager starts at $44,000 per year, whereas state and federal agencies pay anywhere between $60,000 to $90,000 per year for the same degree and credentials. This is a main reason why our case managers leave to work for a state or federal agency. Far too often, I've seen dedicated caregivers leave positions in the community-based human services sector to pursue similar positions with the state or federal government. They end up in very comparable jobs, helping similar clients receive the dedicated services that they need. While both community-based jobs and state or federal positions do the same work, the pay is drastically different. and this unfortunately creates a two-tiered system of care, where many workers come into our field for a year or two and often leave for a better paying opportunity in government. And we're not upset with these workers. They're just trying to do what's best for them and their families. But it is frustrating to see our best and brightest leave the sector, resulting in a loss of continuity of care to the clients that they serve. I personally feel that our job is just as important as the work done by the state and federal agencies. At Bristol Elder Services and throughout the Aging Service Access Point Network, we go out to these families' homes and we really get to know these elders. We form a bond with our clients and their families at one of the most vulnerable times in their lives. I love the work that we do, and I have seen firsthand the impact we make in these individuals' lives. But we've also seen the discrepancy with our home care workers as well. Many homemakers and health aides make a minimum wage, which is roughly somewhere between $13 to $15 per hour, and it's just not a livable wage in 2021. It has been extremely difficult during the pandemic to find available workers to care for our elders. Without increasing salaries, it will become increasingly difficult to attract workers to this demanding work as the minimum wage continues to increase, causing wage compression to become a major issue in our sector. Without ensuring fair pay in the human services sector, we'll often find ourselves competing against Target, Whole Foods, and other retailers for qualified staff, which should not be the case. Our sector's workers are essential, and the jobs they have are incredibly complex and involved. Our homemakers and health aides are the people who get our loved ones out of bed every day. They get them showered and dressed, prepare their meals, and keep their homes livable. They hold their hands and they listen to their stories. They bring joy and companionship to these individuals who really need it the most. We need an act relative to pay for comparable work in order to keep our workers in the community-based sector and ensure a high quality of care for the elders we support. For the difficult, taxing work our workers do, we deserve to be fairly compensated, and our elderly community deserves to have a consistent and reliable workforce. I urge our legislators here today to pass this comprehensive bill that simply calls for equal pay for community-based human service workers who provide critical care to more than 180,000 residents across the Commonwealth. Thank you for your time and your positive consideration to this critical legislation.
Thank you so much, Kristoffer and Amanda. As all of our speakers have highlighted, the passage of these two bills will make a meaningful difference in our human service workers' abilities to remain in the field and provide the experienced, continuous care that the individuals, children, youth, and families we serve need and deserve.